Hi there, welcome to the second video in my psychiatry channel in which we're going to talk about all the various disorders. I thought I'd start with the world's commonest one, anxiety. What is it? I mean, it could be described as a disorder, a trait, a feature of a personality, a symptom itself, something related to substances, coming on, coming off. So, maybe we can spend some time talking about what it looks like and then how we as psychiatrists characterize it. Now, this is interesting because we live in an era where nowadays everything is defined by something called the DSM, which is the official manual used by the American Psychiatric Association called the DSM-5, that kind of distinguishes the disorders from each other. In reality, if you ask most practicing psychiatrists, they'll tell you that they kind of merge. So I've seen people with both panic attacks and generalized anxiety and phobias and other related anxiety disorders that kind of merge. And so when I'm seeing a patient with anxiety, I want to know several things. First of all, I want to know what it looks like. And there are typically 3 or 4 different symptoms that are classic to anxiety. One of these is, and we've all done this, and we've all had these by the way, rumination, also known as worrying. Now, some people kind of overthink more than others, and we all know this amongst friends and family, who tends to worry and who tends to not. And that's where the distinction between whether the anxiety is pathological, normal, is become blurred. So now, oftentimes, if you go to a doctor and say, I've got anxiety, you may be labeled as an anxiety disorder, when in fact, you may just have a little bit of anxiety that's worse at certain times. So I and others psychiatrists will tend to kind of challenge that notion that, I have a disorder. I think that some personalities are more anxious than others, and I think when they're stressed or upset or something's going on, that they'll tend to, kind of kick into anxiety mode, which can affect their functioning. So again, it's not an easy distinction to make. Things are not as hard and fast as they look on the internet. And I would caution reading again about these disorders on the internet because they make them sound like they're very distinct and very easy to diagnose and, very specific, when in fact it's a mishmash. Any psychiatrist working in practice will tell you that. Okay, so how does an anxiety disorder manifest? First of all, it's a disorder I know, per the DSM, for 2 reasons. One is it'll cause you subjective distress. You'll feel very much an angst about it. It's troublesome. It will make you go to the doctor's office. It'll make you seek out help. It'll affect you. Okay, so it's very subjectively distressing. The second is it'll affect your functionality. People oftentimes avoid things because of anxiety. They'll defer things because of anxiety. They'll procrastinate things because of anxiety. And you can tell that that's affecting their life. It may also affect their relationships. They might be much more preoccupied in their head and thereby, more irritable, when interrupted or when asked to do other things in the real world. It may affect their performance at work. It may affect their sexual drive. It may affect their interest in things. It may even lead to a depression. And oftentimes anxiety and depression, I've often called them brother and sister, because anybody who's had chronic anxiety for a long time is pretty much not happy and oftentimes can go into a depressive disorder. So to clarify, one of the commonest symptoms I see of anxiety is rumination. It comes from the cow, in that when a cow chews the cud and goes down into its stomach and only partially digests the food, it'll come right regurgitated back up again. It's a bit like the unsatisfying chewing and stewing that patients will relate to me, that it's very much an undigested thought. They can't figure out how to do something. They're spinning their wheels in their head. So these are called ruminations, and they're very common. Sometimes they can affect sleep. Sometimes they can affect concentration in the moment. Sometimes people even think they have ADHD because of it. But in fact, it's very, very common as a manifestation of anxiety. The second one is a bit more physical. And those are what we call somatic symptoms, including things like chest pains, a tightness in the head or the chest, a queasiness in the stomach, butterflies, something in the pit of their stomach, people will say, diarrhea, loose stool, tremors, sweating. Very familiar, common physical symptoms of what is probably much more severe anxiety. You would characterize, for example, ruminations at the more mild end and things like somatic symptoms at the more severe end, but there can be a spectrum, and one can blend into the other, of course. One can cause the other. Typically you'd start with ruminations, and if they're long enough, they'll affect your release of adrenaline and other stress hormones and lead to what we call somatic physical symptoms, so you can feel the anxiety. oftentimes patients will describe not that, but they'll describe this kind of like restlessness, this kind of ants in your pants, antsy syndrome, and that's called free-floating anxiety, according to very much older textbooks, which are better at describing this than the newer textbooks and manuals. And that's a very uncomfortable sensation. In fact, I've actually asked patients, how uncomfortable is it? And if they describe it as discomforting or restlessness, I know that is anxiety. I can feel it through, the video link, or I can see it on their faces. You can get that vibe that they're uncomfortable. And that's a hallmark of anxiety. Other manifestation of anxiety can be a full-blown panic attack. Now, people confuse panic attacks and what we call somatic anxiety all the time. A panic attack is technically supposed to be extreme somatic anxiety, but coming abruptly, out of the blue. Sometimes it can wake people from their sleep. Sometimes it can, cause people to dash out of wherever they are, to bolt, because they have to escape from that very unbearable anxiety. They think they're going to die in that moment, or they're going to lose control. And it's really uncomfortable and very abrupt. And it's hard to de-escalate yourself from such extreme anxiety, but it can be done. And of course, there are as-needed medications, and we'll talk more in other videos about this. But essentially, it's a very, very uncomfortable and extreme form of anxiety that isn't actually dangerous. But boy, does it feel that way to the patient in the moment. And it's very, very difficult and distressing for the patient. And we will talk about treatments and management of this subsequently. But I can tell you that this is one of the commonest kind of co-occurring symptoms I'm seeing in patients who present with anxiety. So this is not uncommon. Sometimes it can be triggered by, anticipation of certain events or places or people, such as, thinking about going on a plane, about to give a speech, feeling put on the spot in the classroom, or sometimes it can happen out of the blue anyway. So I would like to kind of demarcate that as a separate aspect of anxiety that you want to be able to have that properly defined. Now, what's more common than that is actually this build up of the tension and anxiety. That's not a panic attack, although many of my patients oftentimes refer to it as a panic attack. It's actually called what we call a paroxysm, a wave, whereby you have this intense kind of bodily angst and tension, sometimes with the heart beating fast, that just won't leave you alone. It's called what we call very ego-dystonic. It's very discomforting and you want it to go away. And it'll come in waves. And actually I described what we call the natural history. In other words, how does anxiety look through the day? Nobody's anxiety, from my experience and knowledge, is the same all day. Typically there'll be a bump here, there, a bump later on, maybe a bump because of certain news or overreading into something that will kind of make it like this fluctuating kind of waves of the sea. And that is the natural history, as we call it, or the nature of anxiety, the course of how it kind of pans out. That's different to, for example, depression, which is once you have depression, you kind of stay in that state, it might get worse, but it's not going to bump up and down for most people. So anxiety is very much a fluctuating course and presentation, and we want to be able to recognize that. Now, what is what we call the differential? What else could it be? Well, when I'm asking questions about anxiety, I've often noticed that the criteria are actually very similar to ADHD. Oftentimes people will come to me and say, I think I've got ADHD. When in fact, when I ask them specific questions, their discomfort is obvious, the ruminations are obvious, the somatic symptoms are obvious, but the criteria, if you look strictly on the internet or in the DSM, can look very much like ADHD, with things like distractibility, or blurting things out in conversation, or forgetting things, or losing things. And I am a big proponent of ruling out anxiety first because A, it's much more common than ADHD, and B, if we give the wrong medications for anxiety, such as stimulants for ADHD, we can even make it much worse. We can even precipitate panic attacks. So I'm a big proponent for ruling out anxiety first. It's possible to have both, and I have treated both at the same time, but I try to have that safer sequence of kind of assessment and treatment than I would be if I just went with the first impression of the history given to me by the patient. So I hope this is helpful. This is part one of our discussion of anxiety, and I welcome your questions, your comments, your concerns, and I want to be able to talk this through as if I was sitting with you at your desk, as it were, or at a coffee table, just to kind of educate you in general. Now, of course, this is not medical advice, but I'm hoping this is helpful compared to the plethora of information vomit, as I call it, on the internet, which is overwhelming, and especially so for people with anxiety. So stay healthy, and I look forward to seeing you in the next episode.